خلاص. السلام عليكم. الو.
ايه دكتور سمير.
بس ابغى اتاكد انه الدكتور الفرنسي يدخل، علشان لازم يدخل من
يلا
بدري يجرب
يلا
النت.
يلا حقله يلا.
وكمان مروه.
اهلا دكتور، انا
السلام
بعت له.
عليكم، مساء
عليكم
الخير.
السلام،
ابغى
مساء.
اتاكد انه يصير ريما العنزي ونعيمه واسامه ترسلوا لهم رساله.
حالا بعت لهم حالا.
يلا، شايف هم اسامه ارسل لي حيدخل بس احتياطا. طيب.
تمام.
يلا، مع السلامه.
مع السلامة.
Bonjour, professeur.
Hello, good morning.
Good morning. How are you? Good.
Fine.
Dr. Samir, Professor Fernandez, he's with us already.
Okay. If you want, we can test if I can share my presentation to avoid any problem. Good morning, sir.
Good
Good morning.
afternoon, Prof. How are you?
Dr. Samir, Professor.
For me, it's still the morning because it's
Welcome.
midday.
It's
Welcome.
our pleasure that you are going to be with us. It's already now afternoon, so I would like to thank Selena and Zweig and everybody because you will be another privilege to be with us. Thank you very much. And I'm seeing Osama also join us. Dr. Osama Khoja, he's director for MidLab in Habib, Sweden. So welcome, Dr. Osama.
A pleasure to be with you today. Thank you so much for having me.
Thank you.
Okay.
So would you try to see if it works, sharing your screen?
Yes.
You can try to share your screen right now.
Oh, what's happened?
Yes.
Yeah, perfect. We can see it right now.
You see?
Yes.
Okay.
This is, I think, the Dr. Osama
Yep.
presentation.
I think I already shared the screen
Yeah.
and it was
okay.
absolutely perfect. So I stopped.
Yeah, this
Yeah.
is the one. I'm just saying that we saw the presentation. Okay,
Thank you.
good. Okay.
So, Prof. Fernandez, how's the weather now in France?
It's quiet. At this moment, I am not at home, but I am in the Brittany part of France because I have an house, and it's a specific weekend because it's out of work because 11 of November it's the anniversary of the end of the First War, and we don't work this day. In spite that this war is finished since 110 years, but it's like that. So it was for me to go in.
It's a long weekend now because 11 of 11, the end of
Yes.
First World War.
Nice. Nice.
France is the only one who celebrate this, Professor? I think so.
Yes, always. In spite that all the warriors are dead because it's old people, very old people, but we continue to keep in mind that it's important to avoid every part in the world the war. But you know, like me, the difficulty to understand this situation, but it's probably always necessary to keep in mind for the younger this the history.
I think there is some questions. I will try to see all of them.
Yes, I hope so. How many people will be on this webinar?
How much you think, Prof, joining us now? Give me a number who join us until now before we start. Just estimate it to see how we are active.
Okay.
May I say something? A number?
Yes.
We can see it.
The webinar is only for 3,000. Now it's already full. Now we change to YouTube because it's full now.
So there are more than 3,000 people watching us today.
Yes, I think that it will be up to 10,000. Now, if you see, we start to say that, please register through the link. You can go through the YouTube.
Yeah.
Because it's full now. It's a huge number. And this shows the importance of endometriosis. It shows how are the importance of our speaker and how is the support we are receiving from Zweig and the support we are receiving from Top House Conference and from Habib, Sulaiman Al-Habib.
Yeah, true. It's a great collaboration.
Yes.
Dr. Osama, you can give a little brief for Professor Hervé on Sulaiman Al-Habib, just for him.
Okay, it will be my pleasure to say that. So even my voice is a little bit rusty. So Dr. Sulaiman Al-Habib, it's the leading healthcare provider in the region. If you would to frame Dr. Sulaiman Al-Habib, I think the vision of Dr. Sulaiman Al-Habib, it's the best way to start. The vision of Dr. Sulaiman Al-Habib has been written in 2002. At that time, it was only after 6 years of establishment of a polyclinic. It was only a polyclinic in 1995. So in 2002, Dr. Sulaiman Habib himself has this visionary approach by stated that our institution or organization will be the most trustable healthcare provider in medical excellence and patient experience globally. So in the globe. At that time, Dr. Sulaiman Habib has no single hospital been built. So the first hospital, it was launched in 2008 in a remote region in Al Qasim province, where it's the Al Habib family are originally from. After that, they opened the second hospital at Dubai city in United Arab Emirates. After that, they opened the first flagship hospital in Al Rayyan district in Riyadh with the capacity of 400 beds. Today, the hospital functions in 3 different countries in 4 different provinces, and beneath that there are 10 hospitals, major hospitals. Only this year, we successfully launched 3 different hospitals. The first medical city with the capacity of 700 beds in the north of Riyadh. If you visit Riyadh, you will see a very huge building, or I will say a medical city. Actually, to the extent they named the train station to at that area as Dr. Sulaiman Habib Medical City train station, because very big, humongous building. It consists of 2 towers with 5 floors of bridge connected the 2 towers in the spectacular area in Riyadh. So Dr. Sulaiman Habib, if as financial facts, it's according to economic journal, last year, the revenue for all listed companies in the Middle East, around 85% of the revenue, it's only been scored under the balance sheet of Dr. Sulaiman Habib Medical Group, 85%, and the remaining of 42, it's for the rest of the 9 listed healthcare providers. Last year, I think by euro, the revenue over than 2.5 billion euro, the revenue, the total revenue, and the net profit, it's about 24% of that. Our first 3 quarters showing a growth of almost 20% of the numbers of the previous year, and in the upcoming 2 years, we are in in the huge transformational plan to double our capacity. Currently, we have almost 2,800 beds in those 10 different hospitals. Final information, Dr. Osama Al-Habib has its core business, which is hospitals and serving a community, but there is a couple of subsidiaries. It's worth to know that those subsidiaries, it's complement Dr. Osama Al-Habib services. One of them, MD Lab, Medical Diagnostic Laboratories, which was established in 2013, and it's specialized in conducting special and reference testing. Also, we have a Cloud Solutions, one of the subsidiaries called Cloud Solutions, which is from its name, it's an IT service. Actually, the health information system inside the hospital, it's called VIDA. It's developed by Cloud Solutions company, and now it's been operated in almost more than 40% of MOH hospital, the governmental hospital. Now almost 80 hospital, secondary hospital in the MOH, utilizing the Cloud Solutions VIDA system. Also, we have a Flow Medical Solution, which is dedicated to biomedical engineering. We have Middle East Pharmacy, which is from its name, it's responsible for outdoor pharmacies, and it constituted about 20% of the revenue of Dr. Osama Al-Habib. One new solution, or one of the new subsidiaries been established 4 years ago, which is Habib Medical Center, to help community and to do a preventive medicine strategy. So that's briefly about Dr. Osama Al-Habib when it comes to service, vision, and some financial facts. Over than 20,000 employees currently under Dr. Osama Al-Habib.
Thank you, Dr. Osama, for your nice introduction. I would like to welcome Dr. Naima Shanqiti and Dr. Reema Al-Anizi. Dr. Naima, we are going to introduce her during the webinar. Also, Dr. Reem. Dr. Naima, she will introduce, as we agreed, she will introduce both Prof and Dr. Reem, and I'm going to introduce Osama. But we are waiting to be 2 p.m., so we'll start. I think still 5 minutes. I'd like to thank Naima and Reem for joining us for webinar. Thank you very much. I know it's Friday and we are taking time from your family, but I'd like to thank everybody. And now 3,000 already we reach are hearing us, and it's going to be, the rest are going in the YouTube. So we suspect huge number will join, and this shows how it's important of endometriosis.
يعطيك العافية دكتور سمير على هذا الويبينار اللي إن شاء الله حيكون له امباكت على الاويرنس للهيلث كير بروفايدر. بس عندي مداخل، أنا يعني اللي I'm ready to introduce دكتورة ريم العنزي قبل the initial agreement عشان ما يكون في، لأنه I'm ready for، لأن التايم الآن مرة قصير، فأنا I prepared for دكتورة ريما.
Okay, so I'll introduce the rest. Okay.
خلاص.
دكتور سمير كيف حالكم؟ شكرا
يا هلا الله يسلمك.
دكتور أسامة كيف حالك؟ I hope you're doing fine. كنا مع بعض في الجامعة فعشان كذا متذكرة دكتور أسامة.
حياك الله دكتور ريم، بالعكس ما يحتاج، معروفة زميلة الدفعة، أنا واكرم. الله يرضى عنك.
أكثر إن شاء الله.
الله يبارك فيك، حياك الله دكتورتنا. عرفت انك رحتي يو انت جدة but I'm not sure currently.
لا هو بجدة.
جدة، الله يسعدك وين ما كنتي، وفقك الله ورعاك.
الله يسعدك ويخليك يا رب.
Still you have the same contact number or you changed it?
Yeah, the same contact for anything.
Okay,
you can contact me.
Thank you so much دكتور ريم، الله يسعدك.
And I asked for the link حق اليوتيوب دكتور سمير. So I sent it for the group because a lot there were asking me about the link.
Thank you. Because, yeah.
I got it already. I sent it for people because
Thank
I know
because now nobody can go.
I know they told me it's full.
Full.
MashaAllah. Alhamdulillah.
Yes, and I typed the link of the live YouTube on the chat of this webinar in case if anyone wanted to join.
When do you want us to start? So we'll start, Huda. We'll start. Okay. Assalamu alaikum. Good afternoon, everybody. Jum'ah Mubarakah for everybody. I think today is quite a unique day. We are going to talk about endometriosis and the strategy to fight endometriosis. It's my privilege that we are going to speak with the support from Zwick Company, from Top House Conference, from Sulaiman Al Habib, and from Dr. Rima, Dr. Naima Shangiti, and Prof. Hertez, everybody. Today, because endometriosis, it's a chronic disease, it's affects 10% of worldwide women. Its incidence of Saudi Arabia up to 14.3 endometriosis in our study. It's a complex disease. Everybody want to fight for a strategy of endometriosis. So today we are all of us coming to tell about some of the tests we are going to tell about endometriosis. We know that there is no biomarker for endometriosis. However, now a new thing coming from the week about saliva test, which is called Endotest, which gives a sensitivity of 95% and a specificity of 94%, which is approved by Saudi FDA. Today we are going to discuss. I would like to thank all our speakers. I would like to thank all our participants. I know that now we are reaching 3,000, so the other they can join through the YouTube to continue hearing us, and we are more happy to reach that number. I know it's a busy day for you. It's a weekend, so thank you very much for joining us. Today it's Madame Lina and Zwick. They inform me they are going because of endometriosis. It's March. So people who are born in March, we are going to select 10 of them, of the people who are born in March, to send to Marwa, to Top House Conference. We are going to choose 10 of them to either attend the workshop, which is going to be in 28 November for placenta or ovulation induction, or to attend the conference. It's going to be a free gift for them. So it's our pleasure to announce that one. And now it's my pleasure to introduce first Dr. Naima Shangiti. If she wants to talk anything, Dr. Naima Shangiti, she's a consultant obstetrician and a gynecologist. She's in charge for OB-GYN department in Ministry of Health. She's in charge for the management. So I'd like to give her the microphone if you want to talk anything, Dr. Naima.
السلام عليكم ورحمة الله وبركاته. شكرا للدكتور سمير والجميع المشاركين سبيكرز اللي يتكلموا في موضوع جدا مهم. كما ذكر الدكتور سمير إنه موضوع challenging. Endometriosis is considered as a chronic disease. It affecting the patient lifestyle and quality of life. And during this webinar, we're gonna speak about as we said, according to the agenda, and at the end we will elaborate on the Saudi guidelines regarding managing in such cases of these complicated cases. So I will back to you, Dr. Samir, and we'll follow the agenda of our webinar.
Thank you very much, Dr. Naima. It's my pleasure to introduce one of distinguished speaker for his going to join us today. Prof. Fernandez, he's the head of gynecology and obstetric department at Besret Hospital at the University of Paris, at Paris, Saclay, since November 2023. alongside his professional position. Prof. Fandez, he's an editor and chief of gynecology, obstetric, and biology of reproduction and medical surgical encyclopedia, gynecology, and surgical technique. Prof. He is actually an author of 359 papers published in international paper, medical review journals. Prof. Fernandez, he's a reviewer of many international journals and an active member of many specific society and specific including College of Obstetric and Gynecology and the Society of Pelvic Gynecology Surgery. He's well-known figure, Prof. It's our pleasure that he's joining us. We are going to give him the microphone. He's going to give us a nice talk and a beautiful talk about microRNA, endometriosis, and fertility. Welcome, Prof.
Thank you very much for your presentation, and I hope to have, and it's a pleasure to have the possibility to share with you some idea about all this news about salivary microRNA signature for diagnosis of endometriosis. I'm going to begin my presentation. I want to know if you see my presentation. It's okay? You see my presentation or?
Not yet.
No, we cannot see it. Not yet. Can you try it now, please?
You don't see?
No. Can you try to share again?
Yes. I don't know why, because when we test 10 minutes ago, it was okay.
Okay, so are you clicking on the button share that is downside?
Meanwhile, I would like to say that now we are reaching 3,000. So people, our colleague, they can join the YouTube to hear our
And now it's
lecture and
okay?
presentation.
Now it's okay?
No, no, no. Can you tell us what is happening with you when you click the share button?
2 minutes.
Okay. Take your time, please.
I'm sorry.
Professor, can you send me your presentation? Maybe I can share it with them.
I send you.
Or I can type on the chat my email directly and you can send me the presentation.
I lost my presentation.
It's okay. Take your time.
Okay, I send my email in the chat.
Yes. Okay.
Meanwhile, I'm going to talk about our conference. I would like to encourage all our participants who like to join us for our conference, which is going to be the 6th conference of Gynae. It's going to be in Crown Plaza, Digital City, Riyadh, 29-30 of November in Riyadh. So welcome everybody who like to register. And at the same time, we have 4 workshops one which is about placenta. The second one is going about ovulation induction and cosmetic. The last one is going to be in Crown Plaza Digital City in Friday, which is 29 November. Other three is going to be in Habib Suwaidi. So welcome, join us. It's our pleasure to see you again and again. We have 8 international speakers and a huge number of national speakers who are going to join us there from university, from private, from government, and from military hospital. Welcome, join us. We are so happy to see you again and again. Top House Conference making a special discount for people who are attending the conference and the workshop. I'm sure you will enjoy. You will see a lot of activity. We hope that everybody will be there. I hope that it's ready now, Prof.
دكتور سمير إذا في إشكالية ممكن go to the next speaker.
Yeah.
Meanwhile to correct. What do you think?
Are you ready, Prof, or we'll go for next speaker, Dr. Osama?
I think the next speaker at this moment it will be better. I'm sorry.
Okay. Sorry for that, but until it will be improved, so I'd like my pleasure to introduce Dr. Osama. Dr. Osama, he's going to talk about a reliable saliva biomarker for endometriosis. Dr. Osama, it's difficult that I'll introduce him. He's like my son, Osama. I know him for quite long time. Dr. Osama, he's well-known figures. Dr. Osama in Riyadh, all over. He is one of the charged people in Habib. Dr. Osama, I'll say that he's a dedicated educator, serving as assistant professor and program director for residency programs at King Saud University. He has held numerous positions of a leadership, and including roles at Dr. Suleiman Al Habib Medical Group, HMG, Medical Diagnosis Laboratory, MedLab, and Sultan bin Abdulaziz Humanitarian City. He served as a consultant institution like King Abdulaziz Medical City and National Guard Hospital. Furthermore, he has held leadership position within the College of American Pathologists, CAP, and he has been involved in supervision of student organization at King Saud University. His national and international training, including master degree from the University of Oxford and the University of Sydney, further enhance his expertise. Welcome, Dr. Osama. It's your floor to start.
Many thanks, Dr. Samir, for introducing me to this wonderful panel and highly participants meeting in a wonderful day. So as you stated that we have known to each other for many years, it's nice to disclose that in 2007, I was doing my internship at King Fahd Medical City at that time in the gynecology department or hospital. It was my first time to encounter Dr. Samir Sindi. After that, I did my shares in the pathology, starting in immunology department. However, I shifted my career to molecular genetics. And because molecular genetics, at that time, it was evolving as the best tool to reach to precision medicine. What a coincidence today, after 5 years of being focused in healthcare administration and doing recently a finance degree, I truly was interested in presenting what I believe one of the powerful tools to elevate a drastic impact of a disease called endometriosis to our patients. So when Dr. Samir, almost 2 years, introduced me to Zewig solution, at that time they just published a developing cohort constituted of 200 patients, and it was a promising solution. What a saliva test can do more than an early, accurate, reliable diagnosis. So at that time, it was an interim early fact. However, I kept it in my radar. But after a newly publication with another cohort constitute of 200 patients at New England Journal of Medicine Evidence Journal. I asked Zoe to present this talk in return to my previous passion, which is genetic. If you recall, almost 9 weeks ago, Nobel Prize announced in philosophy and medicine the winners two winners who discovered the microRNA, and in the physics segment, the winner who participate in developing the artificial intelligence. And what a coincidence! This solution is a composed the artificial intelligence with microRNA sequencing. So let's start. What is endometriosis? It's is it really a disease that considered to be rare to see? To start with, endometriosis is characterized by the presence of endometrial-like epithelium and or stroma outside the uterine cavity. The growth of this tissue is frequently associated with inflammatory processes. And excuse me. And during menstruation, endometriosis lesion can react in various acts according to the hormonal levels, leading to an acute inflammation, bleeding, and severe pain, and many other symptoms. Interestingly, the endometriosis could be asymptomatic, and it might be incidentally being diagnosed when there is a difficulty in conceiving. And in fact, a significant proportion of patients with endometriosis can suffer from infertility. In a study in Saudi Arabia and Western region, it constitutes 40% of individuals who've been diagnosed with endometriosis, they suffer from infertility. Worldwide, there is around 10% of women in the childbearing age are affected by endometriosis. So what is the solution today that I want to discuss and present? It is a saliva-based test from Zoe Lab, and it allows women suffering from endometriosis to avoid unusual, long, hectic medical journey. In many occasions, the defer of diagnosis reach to 12 years in average, and more than that, it might need a surgical intervention to reach to the final diagnosis or to exclude the endometriosis. The Zoe endometriosis, it's a test that provides an early diagnosis and enhance the quality of life of the patient, and also it might optimize the treatment strategy plan, as we'll discuss in the further slides. So what is the test? It is in vitro, so it's not in vivo, it is in vitro, so it's non-invasive diagnostic device that must be prescribed by healthcare provider, preferably gynecologist or general practitioner with the interest in women disorder, to diagnose endometriosis by saliva sample. It is a truly an innovative, non-invasive diagnostic tool based on the analysis of salivary microRNA, not messenger RNA, not transfer RNA, and not ribosomal RNA. It's a microRNA via or through next generation sequencing and artificial intelligence modeling. It's a quite impressive performance by blending the NGS with AI, that resulting in at least 95 sensitivity and specificity, which is rarely seen in the clinical practice. So what is the science behind Zoe Endotest? It is primarily rely on microRNA. So in recent years, there has been increasing evidence that linking expression or downregulation of subset of microRNA with the pathophysiology of developing endometriosis. And there is quite few publication link between developing microRNA or developing endometriosis or worsening the endometriosis with a subset of overexpression of microRNA. However, Zoic Endotest successfully, with the power of AI, categorize only 109 different microRNA with a specific signature that enhancing the reliability of accurate diagnosis of endometriosis. So those are the 8 scientifically published papers before 2020. However, all of those studies are not relying on saliva, it's rely on the blood samples. And they use only a basic classic logistic regression model, not an AI. So Zoic Endotest focus on the subset of microRNA, not on the wide range of microRNA. Hence, it has a reliable diagnosis and also help in enhance the fertilization rate. So the result of using Zoic Endotest in the developing cohort have identified 4 world-class innovation. It is non-invasive, using saliva sample, plus it utilize almost 2,600 all human microRNA as a novel biomarker. And out of the more than 2,600 microRNA, they with applying different pipelines and algorithm, they identify only 109 microRNA who has more penetrance to developing endometriosis. They utilize next generation sequencing, and the result being reliable and accurate, even after doing an extended external validation studies, as we will see in the next slides. So this is the primary publication that involved 5 centers based on 200 patients, and it was published in the Journal of Clinical Medicine 2022. And by using different data set, where the artificial intelligence play a vital role, they identify that by applying data set number 4 in their study, the area under the curve, it's 0.98 with the sensitivity higher than 96 and almost a specificity of 100%. And this is a remarkable finding. And in those data sets where the 109 microRNA were sequenced thoroughly. So this is what they call it, the validation of the solution by doing NGS and AI. And then after that, they developed another study that includes 15 centers in France to recruit 800 patients. So in total, with the previous 200 to reach to 1,000 participants in the final analysis, and they published the interim results in the New England Journal of Medicine Evidence. And those data, which presented here, it's only for the 200 out of the 800. So it's not for the whole 800 patients. So the interim data, it's also very promising, and it's actually replicate what they claim in the original publication. So by focusing only in 109 microRNA, utilizing the power of the AI, the sensitivity, which is important to rule out the disease, more than 95, and specificity also more than 95. And the area under the curve is 0.96. So it's confirmed this solution is reproducible and it's give an accurate and stable result. And the beauty about doing the external validation, it's providing temporal and geographical validation for utility of the test. And from clinical laboratory, if you have a test that could offer you equal or more than 94% and sensitivity and specificity more than 79, this test could be utilized in clinical practice. So without any doubt, this test, Zoing Endotest, could be a potential replacement in the current practice. So in the both publications, there was some clear indication for utilize the test. So it's only restricted to the patient who suffering from endometriosis or have symptoms similar to endometriosis patient with the age group not less than 18 and not more than 43 years of age. And they offer the test for a patient with symptoms that suggestive endometriosis, and also it could be extended to unexplained infertility. Suggestive symptoms include chronic pelvic pain with a classic presentation of endometriosis and plus minus infertility. And out of that, there is a suggestive pathway how we should implement Zoig Endotest in our clinical practice. So if we faced a lady with the sign and symptoms suggestive of endometriosis, doing clinical examination plus imaging with ultrasound or MRI, so we have either a normal or abnormal result. If we have an abnormal result, then we could go to the medical and surgical treatment. If there is a normal or the result is not convincing the presence of endometriosis, then we could do the current pathway, which is do an empirical medical treatment. However, 30 to 40 women might not prefer to take the hormonal treatment as a reason they don't like it, or it's contraindicated for to apply it to them. And so if they don't prefer, or the medical treatment show no efficacy, so Endotest should be implemented, or from the beginning you could do the Endotest. This is two ways to implement the test in the clinical practice. And the third important way, if you have unexplained infertility, so these are the three I will say indication where we could incorporate Endotest in our practice. What's the advantage to utilize Zoig Endotest? So it could be utilized in diagnosis any stage of endometriosis according to revised American Association for Reproductive Medicine. And also it has a very high sensitivity and specificity level. It is simple, non-invasive, and it gives you a very clear result, not equivocal, either a positive or negative, based on 109 microRNA sequencing. And also it's considered to be a rapid test to diagnose the disease. What are some of the major limitations? The patient must not to have a history of cancer or HIV infection. Also, the patient must not to be pregnant during the time of testing. Again, it is truly a cutting-edge technology, leverage the NGS and the AI modeling. So the first step is to do a proper sample collection. After that, you should have purification of microRNA extraction, doing a sequencing of those extracted material of RNA by next generation sequencing. Of course, not on this analyzer. According to the literature, or they use the NGS on a big machine. It's called Nova 6000 by Illumina company, and then by their, I will say, AI developed pipelines, and using bioinformatics analysis, they could reach to the accurate diagnosis. Those are a couple of publications where zooic endotest being cited or being explored. Those couple of those are a prestigious, well-known journal like New England Journal of Medicine Evidence or Frontier, Nature Scientific Reports, and etc. So, have we reached to the end of the mysterious diagnosis of endometriosis? Is the game over? Maybe, maybe not, but I believe having zooic endotest, it will enhance early diagnosis, accurate intervention, and timely management of patients who are suffering from endometriosis. From zooic lab, in their pipeline, they want to do extended their research to include the adolescent. As we stated, the minimum age to do the test is only 18, and also to have a power of what ongoing feeding data to have a predictive tool, and also to understand the biological phenotype beneath the endometriosis diseases. The workflow of collecting data, collecting sample, it must be started by the prescription from a healthcare professional. The sample will be collected, then will be shipped to the zooic lab, and the turnaround time to having results to the physician, it's between 4 to 5 weeks after receiving the sample to the central lab for doing NGS and AI modeling. So, is it permissible to do the test while patient under hormonal treatment? Yes, and at any time of the cycle. There is some instruction need to be discussed, and I think there is a video will discuss that clearly. So patient shouldn't be sick, not to drink or chewing gum and eat at least 30 minutes before obtaining the sample. Similarly, not to wear lipstick or brush teeth, and of course not to smoke at least 30 minutes before obtaining the sample. One of the, I would say, samples in the study, in the New England Journal study, almost 5 samples been disqualified because of the sampling issue. So sampling is very critical to obtain timely results. Especially, you should fill the saliva to the filling line and without bubble. And there is a specific technique how you collect the sample. So that's briefly what I think maybe give you an overview about the test. And thank you for your listening.
Thank you very much, Dr. Osama, for your interesting lecture. It's really beautiful lecture. Thank you. And once you want, I think this is a good test, so to send through for investigation. And I would like to ask Prof. Fernandez if he's ready now with his talk. So we'll start. We'll keep the questions and answer at the end. It's your floor, Prof. You can close your screen, Dr. Osama.
I hope so.
Yes.
Hoda, I sent it to you also by email now, just now.
Okay, I don't know why I can't share.
So I'll ask
Lina, you have.
Yeah, Hoda, can you start your screen, please?
I sent it to you, Hoda, now just by email, so you should have it.
Meanwhile, until it will be there, so I'll ask Osama, will it be available in Habib, or when do you think that it will be available?
So thank you for asking, Dr. Samir. So here I would like also to thank Zewg Lab to have a strategic partnership with the Dr. Salman Habib Medical Group, and to be the hub of conducting the collection of samples. We will have a trial to establish the test within upcoming 2 weeks. So I believe, as stated, 11/11 is a good day. I believe the first sample, maybe it will collected in 11/11. So to try the logistics. After that, I think within 2 weeks, we will have it in all hospital of Dr. Salman Habib. And we are welcoming to do the test for any other healthcare institute who are interested to have a reliable diagnostic tool for endometriosis.
Thank you. Now I think the presentation is ready, Prof. So you can start. It's your floor.
You see my presentation? It's okay?
Yeah, it's clear. Again, it disappeared. Huda, start. Yes, we can see it now, Prof.
Okay. Thank you to your colleague, Dr. Osama, to have clarified the use of salivary test and define the best indication to use it, because it's very important. Now, in my presentation, I'm going to explain what is it exactly the microRNA that we can use now and in the future in many diseases. The next, I can change the slide. Okay. It's true that the scientific news at this moment is the revelation that it's very important to speak of microRNA, because the Nobel Prize in Medicine or too scientific is the discovering of microRNA. And 2 weeks ago, the Nobel Physics Prize is about the use of artificial intelligence, and obviously it's the opportunity to understand that the link between the two techniques authorized at this moment to develop a new future for the diagnosis in medicine. Next. Next slide. Okay. What is it exactly? The regulation of a gene. You have the DNA, and the role of DNA is by the messenger RNA to give the transcription, and after that, with the messenger to have the translation for the secretion of protein. In one moment, there are microRNA which go to stop the translation between messenger RNA and protein. So when there is microRNA, there is in some situations no secretion of specific protein. This is a large definition of the use of microRNA. At this moment, I don't speak specifically for endometriosis, because it's a mechanism of balance in your organisms to have a normal life. Next slide. This is another demonstration, more specifically in endometriosis. We have a INDENA database of instruction. After that, due to RNA, specific instruction for specific secretion of protein, and microRNA is like a regulator in some situations. And in case of endometriosis, when microRNA are going to block this translation, there is no protein and there is appearance of the disease. Next slide. The pathological role of microRNA in endometriosis is very important. This situation induces inflammation, reduce apoptosis, so is a possibility to increase the disease in the body, specifically in pelvic area and abdomen, induce cell proliferation, is in relationship to the progesterone resistance, and with imbalance with estrogen dominance, which is a part of the development of the endometriosis disease. There is also an impair in endometrial receptivity, which is in relationship with infertility and endometriosis. And to finish, there is an inhibition of decidualization of the endometrium, which also participate to infertility. But we know since some years that in spite of this relationship with endometriosis, endometriosis is also in the same category of disease like some cancer, neurological pathology, autoimmune disease, is the same history, and this same history is due to the dysregulation of the microRNA. Next slide. Already in 2010, we know the importance of microRNA. It was 15 years ago. At this moment, the team of Panir compelling case that microRNA, long non-coding RNA, and short inhibitory RNA have the potential to influence the development of endometriosis. Rapid advance in non-coding RNA biomarker discovery by this team could be relevant to endometriosis, a new diagnosis. And at this time, 15 years ago, the significance of the non-coding RNA in endometriosis will pave the way for new diagnostic tests. So it's at this moment a long history of development of this test. Obviously, at this time, the RNA was detected only in the blood. Next slide. Another team find that we can also find in salivary gland the same RNA that you can find in the blood. Next slide. MicroRNA are really small non-coding RNA with a crucial regulatory function of gene expression at post-transcriptional level. And the particularity is this kind of microRNA are detectable in cell and tissue extract and body fluid. And this knowledge was the opportunity to develop specific tests and in salivary gland to detect some disease. And the main advantage is a low-cost screening procedure for systemic disease, including endometriosis, including neurological disease, including some cancer, and it will be the future of the new diagnosis in medicine in the next 10 years. Next slide. In this specific article, this team confirmed that we can find salivary iron. It was the same that we can find in the bloodstream. Next slide. At this moment, over the past decade, despite media information campaign, we observe that there is a delay for the diagnosis of endometriosis. And we have not observed, in spite of the knowledge in sonography, in spite of the knowledge of MRI, a part of the diagnosis could not be realized. So the new development to use salivary test is probably the new opportunity to diagnose in some case where the image of sonography and MRI are not useful. We can use this test, like Dr. Osama showed you, to develop a new diagnosis. Next slide. Because for everybody in the world, we must stop this delay with 7 to 10 years in average to have a good diagnosis. And for the majority of patients, or around 50%, they need to have 5 to 10 consultations until to have the diagnosis. All this delayed diagnosis is important in the economic cost, in the health economic cost, because we use many examinations which are not needed if we can use early this new test. Next slide. The main impact is to define that early diagnosis increase the possibility of good care, because probably for the patients, for the mind, it's important to have the knowledge of exact diagnosis, but probably with an early diagnosis, we can define which patient need a specific medical treatment, in some case, which patient need a specific surgical care, but at this moment, we define that the test is a diagnostic test, and after that, when we have the reality of the disease, endometriosis, we can define precisely new algorithm to define what is a good treatment for a patient. Next slide. So, in the definition of infertility, the question is in which case there are in association with endometriosis. And we know at this moment that for the patient with unknown infertility, if we propose a specific diagnosis of endometriosis, we find for 50% of these patients the presence of superficial endometriosis, which is or not, it's very difficult to have this possibility diagnosis, the exact relationship with the infertility, but in this case, it's important to understand that there is a presence of endometriosis, because if we have this definition of exact diagnosis, probably you can propose specific treatment for this patient with the past history of unknown infertility. So we must keep in your mind that 50% with unknown infertility have the endometriosis disease. Next slide. This is the prevalence of endometriosis, which has which is found in this subpopulation of unexplained infertility. The impact is a psychological impact because in symptomatic women with infertility due to endometriosis, a misdiagnosis will add to the diagnosis delay. And this is especially problematic because empirical hormonal treatment is not an option for these women seeking to conceive. So we must have the exact diagnosis and the main interest to have discovered this microRNA to diagnose endometriosis and to use this diagnosis test in this population. Next slide. Now some slide about the RNA in female reproductive health. Small non-coding RNA are well-established regulator of mammalian reproduction. Mounting evidence indicates that non-coding RNA are present in sperm, especially microRNA, and transfer RNA are sensitive to environmental change and mediate the inheritance of paternity. So, in some cases of male infertility, we begin to understand the role of microRNA to block the development and the possibility of fecundation. Next slide. Abnormality of the human ovaries, such as ovarian cancer, for example, and polycystic syndrome and endometriosis, have prompted extensive research into the regulation of microRNA. And obviously, in all these different diseases, microRNA differ in expression level between all these diseases, but the link is the presence of microRNA, which are the traduction of the disease, and which could modify the process of invasion, the process of cell growth, the process of angiogenesis, the process of cell adhesion, and is by this way that we observe the development of the disease. Next slide. A part of this observation is the role of epigenetic mechanism in the regulation of gene expression. We observe that there is a modification of the rate of microRNA or the type of microRNA during the cycle. And probably is the definition of epigenetic mechanism which interfere with the possibility of development or not development of a disease. Next slide. To conclude, this new test is a possibility to build a precise diagnosis in case of male infertility, as I explained, in case of women infertility with endometriosis, obviously, but also in polycystic ovarian disease. And the knowledge of that is a possibility to probably modify the IVF outcome or to modify the guidance of treatments, because with a true definition of a good phenotypes of the disease will be the possibility to find in the future probably new treatment. Next slide. At this moment, you are in the new era of molecular biology, with the possibility to use this new biomarker and this possibility in probably in the next future to have a phenotype, the exact phenotype of each disease due to the knowledge of which microRNA it includes in each disease. Next slide. So the knowledge of this phenotype is probably the prediction of the efficacy of the new treatment in direct relationship with this biomarker. Next slide. To conclude, at the beginning of my presentation, I said that endometriosis is in relationship with many other diseases like autoimmune disease, cancer disease, neurological disease. The known and the unknown in the future of pathophysiology of endometriosis could be include some information, and with the knowledge of the phenotype due to the knowledge of this microRNA, it will be probably the possibility of prediction of the evolution of each disease. This is the aim of the next discover, the next work that we must begin, and we begin at this moment to develop quickly new trends in medicine. Next slide. In conclusion, salivary microRNA is a signature for endometriosis, is a possibility to have a non-invasive and accurate diagnosis, is a possibility to have a complementary diagnosis to image sonography of MRI, is probably diagnosis as a role in prevention of other disease, and biomarker opens a gateway to determine phenotypes, disease, evolution, prognosis, and treatment response. Thank you very much for your attention. I'm sorry for this difficulty due to the slide. I don't know why I could not share this presentation. And obviously, if you have some question, I am to your disposition. Thank you very much for your understanding.
Thank you, Professor Irving.
Thank you very much, Professor, for your very, very interesting background of this innovation. And we want to welcome the next speaker, Dr. Samir, with us.
Please continue, Dr. Nayo.
Okay, just because I didn't hear your voice, that's why I took over. Okay, the mic for you, Dr. Samir.
We'll continue presentation for Dr. Arima. So we want to introduce Dr. Arima, and then we'll have we'll put the video films.
Okay. Good afternoon back to our audience. Today, it is my pleasure to introduce our speakers for today. An expert in the field of reproductive health and a dedicated advocate for advancing care in women's health, especially in managing complex conditions like endometriosis. Our speaker today brings extensive experience in the diagnosis and the treatment and the management of endometriosis. So we want all of us to join me to welcoming Dr. Arima Al-Anizi, obstetrician and gynecologist and minimally invasive gynecology surgery. Had a fellowship in advanced gynecological laparoscopic and robotic surgery in Australia. And she is the chairman of Women Health Center at the International Medical Center, Jeddah, Saudi Arabia. She will share us today a valuable insight and give us an overview about the new guidelines, Saudi guidelines about the management of endometriosis and how we as a healthcare professional can do better to serve our patient dealing with this condition. Mic for you, Dr. Arima.
Good afternoon, everyone. Thank you, Dr. Naima, for the introduction. Thanks, Dr.